If you've ever looked at your Medicare card and wondered, what's the difference between Part A and Part B, and what do they actually cover? You're not alone. Most people turning 65 have no idea what each part does. And that confusion leads to gaps in coverage, unexpected bills, and a lot of stress. Today we're going to fix that. In the next few minutes, you'll know exactly what Part A covers, what Part B covers, and what falls through the cracks that most people don't expect. Welcome to Medicare Made Simple, where we break down Medicare in plain English so you never miss a benefit. Let's start with Part A, Medicare. Part A is your hospital insurance. Think of it as coverage for when you're admitted somewhere overnight. Part A covers inpatient hospital stays. If you're admitted to a hospital and you stay at least one night, Part A kicks in. It covers your room, meals, nursing care, and most of your treatment during that stay. Part A also covers skilled nursing facility care. This is important. If you've had a hospital stay of at least 3 days and your doctor says you need skilled nursing care after, like physical therapy or wound care, Part A covers up to 100 days in a skilled nursing facility. The first 20 days are fully covered. Days 21 through 100 require a daily co-payment. Part A covers hospice care. If a doctor certifies that a patient has a terminal illness with 6 months or less to live, Part A covers hospice services, including pain management, counseling, and support for the family. And Part A covers some home health care. If you're homebound and need skilled nursing or therapy services, Part A can cover those visits. Now here's something most people don't know. For most Americans, Part A is free. If you or your spouse worked and paid Medicare taxes for at least 10 years, 40 quarters, you pay zero premium for Part A. You've already paid for it through your payroll taxes your entire working life. Now let's talk about Part B, Medicare. Part B is your medical insurance. Think of it as coverage for everything outside the hospital, your everyday medical care. Part B covers doctor visits. Anytime you see a doctor, specialist, or other healthcare provider. Part B covers 80% of the approved cost after you meet your deductible. You pay the remaining 20%. Part B covers outpatient care. This includes surgeries or procedures done without an overnight hospital stay, emergency room visits where you're not admitted, and same-day procedures. Part B covers preventive services. This is one of the most valuable parts of Medicare that people overlook. Part B covers annual wellness visits, flu shots, mammograms, colonoscopies, diabetes screenings, and many other preventive services, often at zero cost to you. Part B covers medical equipment. If your doctor prescribes a wheelchair, walker, oxygen equipment, or blood sugar monitor, Part B covers 80% of the cost. Part B also covers mental health services, ambulance services, and some prescription drugs administered in a doctor's office, like chemotherapy. Now here's the key difference from Part A. Part B is not free. In 2026, the standard monthly premium for Part B is around $185 per month. And unlike Part A, you must actively sign up for Part B, which is exactly why so many people miss the enrollment window and end up paying that permanent penalty we talked about in our last video. So let's quickly compare the two side by side. Part A, hospital insurance, covers inpatient hospital stays, skilled nursing, hospice, and some home health care, free for most people. Part B, medical insurance, covers doctor visits, outpatient care, preventive services, and medical equipment. Costs around $185 per month. Together, Part A and Part B make up what's called Original Medicare. Now let's talk about what Original Medicare does not cover, because this is where a lot of people get surprised. Medicare Part A and Part B do not cover dental care. Routine checkups, cleanings, fillings, and dentures are not covered. This shocks a lot of people. They do not cover vision care. Eye exams for glasses or contacts are not covered. Neither are eyeglasses themselves. They do not cover hearing aids. This is a big one. Hearing aids can cost thousands of dollars, and Original Medicare doesn't cover them at all. They do not cover most prescription drugs. For medications you pick up at a pharmacy, you need Part D, which is a separate plan we'll cover in a future video. And they do not cover long-term care. If you need help with daily activities like bathing, dressing, or eating in a nursing home, Original Medicare won't cover that long-term. So what do people do about these gaps? Most people choose one of two paths. Path 1, they add a Medicare supplement plan, also called Medigap. This is private insurance that fills in the gaps of Original Medicare, like that 20% you owe after Part B pays its share. Path 2, they switch to Medicare Advantage, which is Part C. This replaces Original Medicare with a private plan that often includes dental, vision, and drug coverage all in one. We'll do full videos on both of those options soon. For now, here's your quick recap. Part A is hospital insurance, free for most people. Covers inpatient stays, skilled nursing, and hospice. Part B is medical insurance, about $185 per month. Covers doctor visits, outpatient care, and preventive services. Together they form Original Medicare, but they don't cover everything. Dental, vision, hearing, and most prescriptions require additional coverage. If this video helped you understand Medicare a little better, please hit the like button and subscribe. We post new videos every Tuesday and Friday. Drop your questions in the comments. We read every single one. Thanks for watching Medicare Made Simple. We make it simple, so you never miss a benefit.